Pectoralis major, which you're all familiar with now. The deltoid muscle and the cephalic vein runs underneath the deltoid muscle, down through along the humerus. Biceps brachii, okay. The median cubital vein, that's the one you do for IVs, in the median cubital fossa, and the brachioradialis muscle along the side. The thenar muscle, just below the thumb, and the palmar aponeurosis that connects the muscles of the hand to the muscles of the forearm. It's the aponeurosis, the palmar aponeurosis, aponeurosis in the palm of your hand. Doesn't advance like that. Okay. And again, deltoid muscle we're familiar with, cephalic vein, the brachialis muscle, the biceps brachii. Is the biceps brachii a flexor or an extender muscle?
Flex.
Flexor. When you contract the bicep muscle, it decreases that angle between the bones. It's a flexing muscle. It's in the anterior portion of the upper part of the arm. So it's your biceps brachii, your brachioradialis, okay, your flexor carpi radialis, and your palmaris longus. Then you also have your pronator teres muscle. Again, with deeper dissection, you got the coracobrachialis, the long head of the biceps brachii, the short head of the biceps brachii. Bi means two. You got a long head and a short head of the biceps. Okay, there's a long head of the biceps brachii and a short head of the biceps brachii. The brachialis muscle helps support or supplement the biceps brachii muscle. Brachioradialis muscle extends on the lower part of the arm. Flexor carpi ulnaris runs on the ulnar bone, and the flexor retiniculum runs onto the into the wrist. Flexor digitorum superficialis muscle. Pronator teres, it's been cut into two pieces there. It's hard to see it. You have your median nerve, which runs down the humerus, and your pectoralis minor, which you can see after the pectoralis major has been dissected. There's your pectoralis minor. Okay. Pectoralis minor, then reflect and cut away. The coracobrachialis muscle, the long head of the biceps brachii, the brachialis muscle, the median nerve, the flexor pollicus longus. Okay. And just by looking at the name, what that muscle does. It flexes the pollex, which is your thumb. It allows your thumb to flex. Pronator quadratus muscle. The flexor digitorum profundus flexes the digits. The flexor carpi ulnaris runs along the ulnar bone. Brachial artery. The brachial vein brings blood back to the heart. Latissimus dorsi, the muscles on the side. And the subscapularis muscle below the clavicle. That's the deep dissection of the arm, the anterior view of it. Lateral view. Again, you see the deltoid. Triceps brachii, that's in the posterior chamber, posterior quadrant of the arm. So what's the tricep brachii? Is that a flexor or an extender?
Extender.
That's an extender. That works the exact opposite of the brachioradialis. Okay? That allows the bones to increase the angle between the humerus and the ulnar radius. Then you have the brachialis. Here's my brachialis, which is supplemental or synergistic with the brachioradialis. The anconeus muscle, below the elbow. The extensor digitorum minimi. Okay? What does that muscle do? The extensor digiti minimi.
Extends the pinky.
Extends the pinky. It's an extensor of the digit, which is the little finger. Extensor digiti minimi. And again, that increases the angle, brings it back. Okay. Extensor carpi ulnaris. Extensor pollicus brevis, short muscle that extends the thumb, the pollex. The extensor digitorum, extends the digits. Abductor pollicus longus, which abducts the thumb, which brings it closer. Abduct means brings it away from the midline. So it takes your thumb and you pull it away from the midline. That's your abductor. Adduction is to bring this back towards the middle, towards the middle of your hand. Okay, remember your anatomical position, your hands are palm out. Thumb is to the lateral side. Everything is referred to the anatomical position. And extensor carpi radialis longus and brevis, brachioradialis, and the biceps brachii. Okay, looking at the back view, posterior view, you see your deltoid muscle, you see your teres major. Teres minor would be above it, right in here, but might have been cut away, I don't see it. There's your deltoid, there's your teres major, there's your triceps brachii. How many heads does a tricep muscle have?
3.
3. Biceps have 2, triceps have 3. The anconeus again, below the elbow. The extensor carpi ulnaris, extensor muscles, and extensor retinaculum to the wrist. And then you got flexor muscles. All right, back to the anterior view. Your deltoid muscle, which we should all be real familiar with now. The cephalic vein that runs underneath it. The biceps brachii, and that's the fascia that covers it. You can see the white material there. So that's the biceps brachii, that's the fascia. And the pectoralis major. Again, we should all know the pectoralis major muscle. Deltoid, cephalic vein. You can see the cephalic vein really well in that dissection. The short head of the biceps brachii, the long head of the biceps brachii. There's your short head, there's your long head. And this is the pectoralis major. Okay, and looking at the joint. Okay, on the anterior view of the pectoral girdle, you have the coracoid process of the scapula, which is the back part of it here. The acromion is the anterior part that forms the junction with the humerus. So there's your coracoid process of the scapula. There's a head of the humerus, fits up into the fossa there. There's a coracobrachialis muscle. The pectoralis major, which has been cut away, so there's the lateral portion of it. Short head of the biceps brachii, long head of the biceps brachii. This is the axillary and brachial vein for the blood supply. This is the pectoralis minor. Pectoralis major has been removed. You can't see any of it there. So this is your pectoralis minor right here. Okay. This is a subclavius below the clavicle. And here's your clavicle. Okay. Again, here's the clavicle. It's been cut away. It's been cut right there. So you can see underneath it here in the brachial plexus here. The pectoralis minor has been cut back too. This is the pectoralis major has been cut away. This is just like I said, the lateral portion of the pectoralis major. The coracobrachialis, which helps supplement or adjunct to the biceps brachii. Latissimus dorsi, almost on the side. Long head of the biceps brachii. These are your serratus anterior muscles. And right up into that is your external intercostal muscles right here. Biceps, axillary, and subclavian vein. Okay, lateral view looking at the side here. You got the pectoralis minor has been cut away. You got the coracobrachialis muscle. You've got your subclavian artery, subclavian, axillary, and brachial arteries. All three of them run in that group there as it branches off the aorta. Latissimus dorsi muscle of the side, the subscapularis muscle, the brachial plexus that you can see real. We have plexus. Plexus just means a braid, like a trabeculation pattern. interweaving of blood vessels, arteries, and veins, and nerves. That's your brachial plexus. And levator scapulae, and your anterior, middle, and posterior scaling muscles as it goes up the neck. The levator scapula being the most lateral. Okay, lateral view. Again, your deltoid, your triceps brachii, your brachioradialis, your brachialis muscle, biceps brachii, pectoralis major, cephalic vein. All right. There's your teres major and teres minor. Here's the teres major right here. Teres minor is anterior to it or superior to it. This is your deltoid muscle, your triceps brachii, looking at the back. These are latissimus dorsi. What muscle is this where my pointer's at? Everybody sees the pointer. What's this big muscle right here? Looking at the back.
Trapezius.
Trapezius muscle. Perfect. Okay, this is looking at the front now. Turn the body around. This is your pectoralis major. And your pectoralis minor you can't see because it's covered by the pectoralis major. This is the deltoid. Cephalic vein is under the deltoid. Biceps brachii. This is the fascia. It's the white material that covers it. The median cubital vein, that's the one you go after for your IVs. That's the median cubital fossa. The brachioradialis muscle is for the lateral side, is also covered by fascia here. That's your basilic vein, runs along the medial border of the humerus. Again, deltoid, brachialis, the cutaneous nerve on the left side, the nerve right there, the brachioradialis, and the radial artery. That's the bicipital aponeurosis, connects the muscles together, and the biceps brachii. Now, when the fascia has been removed. Because here's your biceps brachii. You can see the muscle fibers. Okay. And another view of the upper arm there, a little bit deeper dissection. Here's the head of the humerus, the coracobrachialis muscle. It's right there, that one right there behind it. The pectoralis major, which has been cut. So this is the lateral border of it. The short head of the biceps brachii, long head of the biceps brachii. This is the tendon of the biceps brachii. Tendons connect muscle to bone. Brachial artery, the ulnar artery, one just below it there, and the radial artery. Okay, what's that? What do we use the radial artery for? Why is it important? I mean, they're all important because they supply blood to your body. But the radial artery is where you get your pulse. That's when you feel for the pulse. This is a pronator teres and the flexor carpi radialis that have been pulled apart, reflected back. There's your median nerve, your brachialis muscle, which supports the flexing of the biceps brachii, and the ulnar nerve. All right, deep dissection. Anterior view again. Clavicle, you can see it's been cut away. This is the end where they cut it, took a saw to it and cut it right there. Pectoralis minor, major's been cut away. Pectoralis minor. This is the pectoralis major portion where it's been cut. Long head of the biceps brachii. Short head of the biceps brachii. It's cut. They're right along here. So this is the long head. This is the short head. He's up here. And the median nerve, the brachialis muscle, triceps brachii, brachial artery, latissimus dorsi, brachial and axillary vein, coracobrachialis muscle and the subscapularis muscle that runs just below the clavicle. All right, lateral view. Again, everybody's deltoid over 100 times already. Everybody should be able to identify the deltoid muscle. Long head of the triceps brachii. This is the tendon of the triceps brachii. Lateral head of the triceps brachii is the lateral head and the long head. The long head right there. And the lateral head, and then the tendon runs right here. The coneus muscle, just below the elbow joint. Brachioradialis goes across the elbow joint to stabilize it. The extensor carpi radialis longus and the extensor carpi radialis brevis. Longus means a longer muscle, brevis means a shorter muscle. Brachialis muscle, biceps brachii, the cephalic vein, and your deltoid. And the lateral view when it pops up. And of course, we have the deltoid. We have the teres major, and I cannot see the teres minor. Oh yeah, there it is. It's right above it. It's right here. Here's your teres minor. Part of it's been moved, used extensively further, but that's where it's located. So the teres minor, the teres major, long head of the triceps brachii, latissimus dorsi on the side, and coneus, the medial head of the triceps brachii, tendon of the triceps brachii, okay, lateral head of the triceps brachii. Okay, so here's your three heads. This is the lateral head of the triceps. This is the long head of the triceps. And it's the medial head of the triceps as it extends down. So it's the three heads of triceps brachii. Here's the teres minor, and there's the deltoid muscle again. Okay, the forearm. Okay, these muscles interact the hand to give you the strength, your extrinsic muscles. Once you get the strength in flexing and maneuvering of your hand. The pronator teres, flexor carpi radialis, brachioradialis. Lost my picture again. There we go. The flexor digitorum superficialis and the abductor pollicus brevis, the short muscle that abducts the thumb, moves it away from the midline. Hypothenar muscle, extensor carpi ulnaris, flexor carpi ulnaris, palmaris longus, and biceps aponeurosis. Connect the biceps muscle to the other muscles going down. Let's do a little dissection. Go further down. You have the brachial artery and the radial artery. So there's your brachial artery. There's your radial artery. And that's what you feel for a pulse. Brachioradialis muscle. The flexor pollicus longus, flex the pollex, the thumb. Flexor digitorum profundus, flexes the joints, the digits. Flexor digit minimi brevis, the short muscle that flexes the little finger with the pinky. Flexor carpi ulnaris, ulnar artery, goes down. Supinator, pronator teres, those are pronate, median nerve, that runs down through the middle. That's one of the nerves that's compressed with carpal tunnel. That innervates the two middle fingers and I believe a third of the first digit and a half of the first digit and a half of the last digit. And brachialis muscle. That helps us support and stabilize the elbow joint and support flexion from the biceps brachii. Deep dissection, pronator teres muscle, flexor digitorum profundus muscle, pronator quadratus, and the flexor pollicus longus. All right, anterior view of the forearm. If you look at the forearm here, we have the extensor carpi radialis longus muscle highlighted, the anconeus on the elbow, the extensor carpi ulnaris running along the ulnar bone, extensor digiti minimi, extensor digitorum, tens of digits, extensor retinaculum at the wrist, extensor pollicus brevis, short muscle, extending the thumb, abductor pollicus longus, abducts the thumb, brings it away from the midline, extensor carpi radialis brevis, and the brachioradialis that goes to supports the elbow and it helps with flexing of the elbow joint. Okay, superficial muscles. This is a posterior view. Look at the back of the hand. You can see the brachioradialis right here. Extensor carpi ulnaris. Extensor digitorum. Extensor digiti minimi. These are your extensor. Remember, extensor muscles are on the backside. Flexor muscles are on the anterior surface. Because when they contract, they pull things back. When the anterior ones contract, they flex and pull things forward. So that's your extensor digiti minimi and extensor retinaculum. These are all extensor muscles. These are the dorsal interosseous muscles between the bone. Extensor pollicus longus. Extensor pollicus brevis. Abductor pollicus longus. External carpi radialis longus, and the extensor carpi radialis brevis. Doing a deeper dissection of it again, all the extension muscles in the back surface and posterior surface of the forearm. Extensor carpi radialis longus, extensor carpi ulnaris, extensor pollicus longus, extensor digitorum, extensor digiti minimi, extensor indicus, extensor retinaculum, the abductor pollicus longus. Okay, abductor abducts the thumb in a direction away from the midline. Okay, so it moves the thumb away from the fingers. Extensor pollicus brevis, extensor carpi radialis brevis, and the brachioradialis. Go back one. There you go. All right, anterior view is a deep dissection of the hand. Abductor pollicus brevis. You got your flexor pollicus brevis. So your contracts it brings the thumb in. The palmar aponeurosis connect the muscles together, the digits of the hand and the forearm. The abductor digital minimi. Okay, and the palmaris brevis. Short muscle in the palm. And we got some deeper dissections here to do. Okay, next layer down, you can see the flexor retinaculum. It's on the internal surface, so it's going to be a flexor muscle. That's your flexor retinaculum. Flexor retinaculum flexes the wrist. You've got your abductor pollicus brevis. You got your flexor pollicus brevis. And you got your palmar aponeurosis. You got your abductor digiti minimi. You got your flexor digiti minimi brevis. And you got your palmaris longus tendon. Go down the next layer. Okay, a little bit deeper dissection now. Your abductor pollicus brevis. Okay, we all know what those are doing now. The flexor pollicus brevis. The tendon of the flexor pollicus longus. Connect the muscle to the bone. The tendon of the flexor digitorum profundus. Those are your tendons. Your tendons of the flexor digitorum superficialis. The abductor digiti minimi. The opponens digiti minimi. The flexor digiti minimi brevis, and the superficial palmar arch. That's what goes around right there. Okay, the antebrachial fascia. It protects it right there. The fascia goes over the white layer. The abductor pollicus brevis. The flexor pollicus brevis. Tendon of the flexor pollicus longus. Okay, there's the tendon. Tendons of the flexor digitorum profundus. Okay, you can see those there again. And the tendons of the flexor digitorum superficialis. You have the flexor digiti minimi. Flex is the digit of the pinky. And you got the opponens digiti minimi. And you have the superficial palmar arch. And one more layer dissection. You got your opponens pollicus. Here's opposition of the thumb. The flexor pollicus brevis. The lumbricals, the muscles of the digits. The opponens digiti minimi. The abductor digiti minimi. That's the deep dissection. Okay, so lateral view on the hand. You have the tendons of the extensor pollicus brevis. You have the first dorsal interosseous. And you have the tendon of the extensor pollicus brevis. A little deeper dissection. Again, the lateral view, a little deeper section. This is the second dorsal interosseous right here. This is the first dorsal interosseous. First and second between the digits. Tendon of extensor pollicus brevis. And the tendon of the extensor pollicus brevis. And one more deeper dissection there. And again, the tendon of the extensor carpi radialis brevis, the tendon of the extensor pollicus longus, the first dorsal interosseous, the tendon of the extensor carpi radialis longus, the extensor pollicus brevis, and the abductor pollicus longus. Okay. Posterior view, top part of the hand. Okay. Extensor retinaculum, that's the wrist. Those are the muscles of the wrist right there. Allows us to rotate, pronate, and supinate. Tendon of extensor digiti minimi. Tendons of the extensor digitorum. Tendons of the extensor carpi radialis brevis. Tendon of extensor carpi radialis longus. Second dorsal interosseous. Here's your first dorsal interosseous, muscle between the bone, and tendons of the extensor indicus. Okay, that's looking at the wrist. That's a transverse section. Again, transverse sections are really hard to visualize. I'm not sure what that is, but that's the thenar muscle up on the top part of the wrist. That's a trapezium bone, one of the bones in the hand, the trapezoid bone, capitate bone, hamate bone, and the hypothenar muscle. Okay? And this is carpal tunnel containing the tendons and nerves. This is the point you can see where it gets cut up. This is your nerves that run into your hand. And you can see if that gets squished or pushed, okay, those nerves and blood vessels are going to constrict, and it's going to cause numbness and problems in your hand. Okay, and that's the surgery to do, is they cut this right here to relieve that tendon right there. and relieve that pressure. All right, let's do a little bit of the quiz and we'll call it quits, see how far we can get. All right, which muscle is highlighted? Anybody want to guess?
The flexor digitorum profundus.
Flexor digitorum profundus. The supinator. This one's a supinator muscle right here between there. Okay. This muscle here, what's highlighted? Brachialis, latissimus dorsi, coraco.
Coraco one.
Coracobrachialis, that's what it looks like. Yep, perfect. What muscle is highlighted? That would be
Mini-me. That would be taking it out. So that would be abductor, digit G, mini-me.
That goes away from the midline. Perfect.
Yes.
In fact, a lot you have to use when you do an exam, just like that. If this muscle contracts, it moves this muscle this way, moves it away from the midline. So it's an abductor and on the digit little finger, which is mini-me. What muscle is highlighted?
That would be the brachioradialis.
That is brachioradialis. Would probably be the best answer there. Yep. Brachioradialis muscle. And what muscle is highlighted here?
Subclavius.
That or the coracobrachioradialis? The coracobrachialis. Coracobrachialis. Okay. I think subclavius runs right here under the clavicle.
That would make sense.
And this would be the subclavius. This would be the coracobrachialis. All right. Well, okay. Everybody should get this one. No missing.
Bicep. Deltoid.
That's the deltoid, right? No one should miss a deltoid on the exam. All right. And back to the hand, that is the wrist is a retinaculum. So it's either an extensor or a flexor.
Extensor.
It looks like an extensor to me too. Extensor retinaculum. Yep, perfect. Because if it contracts, it pulls this hand this direction. So it tends to extend it, decrease the angle between the hand and the wrist. What muscle is highlighted? Is that an anterior view? Yeah, anterior view.
That looks like the triceps brachii.
Which head? Does it have? Lateral head. It looks like the lateral head of the triceps brachii. You're right. And it is. Perfect. And, the muscle right there. The tendon of which muscle is highlighted?
Extensor indicus is for the, looks like it's for the pointer finger.
Yeah. Extensor indicus. Let's see if that's the one that it is. No. The extensor carpi radialis brevis. Extensor carpi radialis brevis. And what muscle is highlighted? It's on the inside there.
Flexor.
It runs close to the ulnar bone.
Yeah.
So flexor carpi ulnaris. Nope, flexor digitorum superficialis. It's a flexor muscle in the anterior quadrant, so it's flexor digitorum superficialis. All right, position of the back. This is the
Major.
Yep, teres major, you got it. Because here's a teres minor right here. That little one right there. So that should be the teres major. Perfect. Which structure is highlighted? That is,
Axillary and brachial vein. Right? I think it looks like it's a vein. So
yeah, it's running where the axillary, right to the axillary. It looks like axillary vein, axillary brachial vein. It's in the muscles. Yep, perfect. Which muscle is highlighted? That is a
it's like a flexor.
or a pronator. Pronator allows it to twist. It goes from medial to lateral.
Oh, okay. So pronator teres.
If I had to guess, I don't have all these memorized. I don't have all 7 of those memorized. I would say the pronator teres, yeah. And the reason I say that because you can see the muscle runs from the medial border to the lateral border. So what it is, when it contracts, it allows the arm to rotate. So it allows it to pronate, supinate. Okay, that's how you would get that guess at that. Tendons of which muscle are highlighted? Those are the tendons of the, it's not the mini-me, it's not the flexor.
Not the pollicus either.
It'd be one of the two middle ones, right? Because it's not the mini-me, it's not the pinky. I think it's all of those. And it's not the thumb, it's not the pollex. So it's either the flexor digitorum superficialis or the flexor digitorum profundus. It looks like a deep dissection. So what should we go with?
Profundus?
Flexor digitorum profundus. Nope, it was a superficialis. Wasn't quite as deep dissection I thought. Flexor digitorum superficialis. Again, it's hard to judge how deep these dissections go. What structure is highlighted? We should get this one.
Superficial palmar arch.
Yeah, it's the only one that's shaped like an arch, right? It's a superficial palmar arch. And what muscle is highlighted here? It's on the dorsum of the hand. It's on the back, so it is going towards the...
It's an extensor.
Yeah, it should be an extensor.
Pollex brevis, because it's not on the mini-me side.
Is it extensor pollex longus or where are we at? Extensor pollex. Yep, the extensor pollex brevis. Small muscle that extends the pollex, extends the thumb. If it's on the distal portion, these are extensor muscles on the back portion here. Front part are flexor muscles. What is the action of the highlighted muscle?
Flexion of the little finger.
Flexion or extension? It would be flexion, right? It's on the anterior surface. Perfect. Flexion of the little finger. Correct. 18. What is the action of the highlighted muscle?
Extension of the thumb.
That'd be extension. It's on the dorsal surface, on the back. When those muscles contract, they extend. So it would be extension of the hallux. Perfect. 18. Highlighted muscle enters on which carpal bone? The hamate.
Hamate?
The hamate and the
capitate.
Capitate. Let's try that. Here's my marker. There it is. Nope. The pisiform and the hamate. Okay. The hamate is the most medial one, but it's the pisiform bone that comes across it. So it's the pisiform bone and the, and that's, you're not cut off, are you, on your screen?
You're frozen. Yeah. Before you clicked it. All right. I can't even see your mouse anymore.
That's all I hear is the mouse clicking.
Yeah, same here.
Well,
we lost everything. Hold on. I'll get it back. Come on back. Can you hear my voice at least?
Yeah.
Okay. We're not connecting to the anymore. All right, let me reset this. There we go. All right. Our reseller quiz of 2 days. Okay. We did the action of that was extension of the thumb, right? Yep.
Yes.
And
Pisiform hamate.
this is what we were at right here. Okay, that must attach it to the pisiform. The hamate's the most medial bone, and the pisiform is one next to it. So it's the pisiform bone and the hamate. And one more question. See if the computer can handle this. The highlighted muscle assists with what action? And it goes into the mini-me, right? And it would either
adduction. Because it looks like when it would contract, like it would pull it back in.
Like it would pull it back in. I would say adduction. It's difficult to determine, but that's what I would say. No, opposition. It pulls the finger and the thumb together when you oppose each other.